Hey everyone, welcome back to Igniting History. This week's episode is going to be about the American Revolution, and more specifically talking about the medical and camp conditions that our soldiers had to deal with during the War for Independence, and what our illustrious leader, General Washington, did to help create a better camp life and better medical outcome for his soldiers and staff. So let's get to it. Remember, if you like this, give us a like and a follow. And again, tell your friends about us, please. So when you're talking about the American Revolution, you have to think about what was going on before we decided to declare independence. Medically, these are the things that we had to deal with. We didn't have the medicines we have now. So things like malaria, smallpox, typhoid, yellow fever, dysentery, those were all big hitters. And it took a lot to not succumb to them. Especially with cities like Boston, New York, places that would have ports. These diseases would be very rampant, with the ships coming in and the insects that carry disease along with the small rodents. Sometimes the cities would put up quarantines, not letting people pass a certain area, which is all well and good. However, if you're an insect or a rat, they don't mean anything to you. So with people living in such close proximity and the hygiene not being the greatest that it is, you can imagine that disease could spread like wildfire, and it did frequently. As you can see on the right-hand side, with some of the remedies that were used during the day, they like to use medicines that would make the body purge, things that would make you vomit, or things that would make you go to the bathroom a lot. Some people prescribe to just drinking a lot of water and exercise. That's just good health anyway, right? They would use medical manuals from Europe, and they try some of the remedies, homegrown remedies from the Native Americans. They would try to go to the doctor, and of course, the doctors aren't that great now, right? So we're still well behind the Europeans. There are two major theories of medical thought at this time about the fluids and the humors, that the body is a balance of four different types of humors, or the other theory at the time was that it was some sort of contagion. And of course, we know now that that's exactly what's going on. Bloodletting was a big deal. They believed that for certain diseases, letting out a lot of blood or a little bit of blood would help the patient recover. Well, in some cases, it killed them, right? So not exactly the best of practices. And then we have inoculation, which is in its very early form of vaccinating against disease, which we're going to talk about here in a little bit. And as you can imagine, if you lived out in the country, you were going to be a lot healthier than you would be than living in the cities, especially, again, like those big cities, Boston, New York, Philadelphia, and some of the larger southern cities as well. People who were in close proximity tended to get sicker. So when the War for Independence broke out, not only did Washington and his staff have to deal with disease, they also had to deal with lack of food and clothing, supplies, and the sanitation was incredibly horrible. Most soldiers, if they were wounded in battle, would die from infection. They didn't use water or any kind of antiseptic technique back then. They had to treat the patient and move on. Most of the time, the knives were very bloody, and they were used with multiple patients. Only 35% of patients who received an amputation survived. So that's not a very good number. However, they did what they could with what they had to, work with. The surgeons, again, they were very primitive. A lot of them never even had battlefield experience. They would use fingers and thumbs and instruments to look for the musket balls. If you were lucky and you were an officer, you would be given some sort of alcohol or spirit. If you were just an enlisted man, you got a wooden stick. That seems like a pretty bad deal. As a matter of fact, if you did lose an arm or a leg, they would only pay you half of your soldier compensation. So that's kind of a slap in the face too. There's probably some sort of joke there to be had, but we're not going to go there. Skilled surgeon, and we're talking skilled, meaning they actually have done this for a while, could saw through a bone in 45 seconds. That's a long time. If you're thinking that 45 seconds isn't very long, well, just sit there and just watch your watch for 45 seconds. It's a long time, especially if somebody's sawing through your leg. Hopefully you'll pass out from the pain. They would cauterize the wound, and the skin flap would be put over, just like it's very similar to the way it's done today. And again, water was sometimes used to clean wounds, but not always. Again, if they were really busy, they just moved on. It's almost like an assembly line. The next one through, we got to get them going. So, as Washington's seeing these things happen, he decides first to deal with the huge outbreak of smallpox. As you can see there on the slide, there's a 7-year outbreak of smallpox, intermittent between 7 years. So he orders the first mass inoculation in American history. Again, outbreaks were frequent. Camps were really close together. They were really close knit. Soldiers were not very far apart from each other. And again, the sanitation was nasty. So what he was going to do, he decided he was going to inoculate every American soldier. The British were already doing this. As the recruits came in, they would be inoculated. So Washington had to decide that, yes, I want to inoculate these soldiers, but I knew there was going to be a downtime. So he knows they're going to have to recover from this. And if the British were to get wind of his soldiers being inoculated, that they could take advantage of this and really give Washington a hard time while his soldiers were sick and ill, recovering from the inoculation. But he did order the inoculations finally on February 5th, 1777, and it seemed to work. You can see here in the picture, this is actually a clip from a video from the John Adams miniseries. If you haven't seen this, I highly recommend checking it out. It's done very well. HBO Films. It's very well done. It's pretty accurate. This scene here shows them inoculating a child with smallpox. It's not a nice, easy shot like it is today. It's pretty nasty. So, along with the inoculations, General Gates, one of Washington's generals, had asked for additional nursing units for this wounded and the sick. So, as you can see again on the slides, the Congress did decide to grant him one nurse to 10 soldiers, or one head nurse for every 100 soldiers. Not only did they treat the sick and the wounded, but they also did daily duties, cooking, cleaning, things of that nature, to help relieve some of the duties that the soldiers had to do as well. Now, you got to remember that this is still the 1700s, mid-1700s, and women weren't as thought of in a nursing role as they are now. They weren't as respected. So they still had to put up with male surgeons who didn't think very highly of them, and who they didn't think women should be in such of a role. However, that chain of thought quickly disappeared as they could see the valuable nature of a nurse. And they weren't always considered part of the military chain of command, which was a good thing, because they kind of do what they needed to do, and they didn't have to really take orders from higher aboves. So as the War for Independence moves on, most everybody's heard of Valley Forge, up in the north, and this was a very badly planned campaign. Washington camped there for the winter, and in 1777 he's got 12,000 souls at Valley Forge. The food and the supplies are dwindling. He's got typhus and smallpox running through his camps. His cries to Congress aren't being heard at all. 3,000 of his troops didn't even have enough clothing, and leaving them unable to fight. So he's lost already, about a fourth of his fighting force. He loses 2,000 of them from starvation and exposure to the elements, along with disease. And so while Congress isn't giving them what he needs, he sends his soldiers out to fend for themselves. He sends them to go get food, go hunt animals, anything he can do to make his soldiers at least some kind of fighting force. And that's where you see the entrance of Frederick William Augustus von Steuben. He was brought in to actually train the army. He's a Prussian, and they call him the drill master of Valley Forge. And he arrives there in 1778. He arrives there as a consultant to General Washington. And again, like he says, his main goal is to train the army. He's not there to do anything else. But while he is there, he notices what Washington's been dealing with this whole time. And what he did do was make drastic changes to the way the camps were laid out, as well as other sanitation changes. He knew recruits were lazy from his experience in both the Prussian army and with watching ours. They would eat inside their tents, but then they would use the facilities immediately outside their tents. So again, there's no separation from infection. There's human waste right outside where they eat. Again, there's a joke there, but we're not going to go there. This would lead to infection, like he says. So he insisted that the holes were dug away from the camp, facing it downhill. Okay, they called them pit latrines at the time. Livestock that was in camp was killed in certain areas, and the remains were disposed of away from camp in special areas. So these are small changes, but they had a huge effect on disease and the health of his soldiers. There's von Steuben right now. Personally, I think he looks a lot like Kevin Spacey. Maybe he's a time traveler. I don't know. Looks a lot like Kevin Spacey, but that's von Steuben. Very instrumental in helping us win the war for independence. Washington, he wants some women, and that's probably misleading, but he knew the value of the way women could run camps and the way that they would be able to help out the soldiers by taking on some of the duties that the soldiers had to do. Soldiers could focus on training and soldiering instead of cooking, cleaning, foraging, and things of that nature. It's a couple of notable women that were in camp: Martha Washington, George Washington's wife, and Abigail Adams was John Adams' wife. Both were, of course, first ladies of the United States. So again, he knew the value of a woman in different kinds of roles. Washington was no dummy. May not have been the greatest military strategist, but he wasn't stupid. So as our surgeons performed more and more procedures, their expertise and knowledge was gained, and they became more proficient. They learned how to use tourniquets, save some blood. They would use myrrh, and if you're thinking you've heard that before, you have. The three wise men brought frankincense and myrrh to Jesus when he was born. Not only was it given to our Lord, it also can clean wounds. Pretty good stuff. They figured water can start helping clean hands and wounds in instruments. Amazing. What a concept. Nurses would help develop stone water bottles, wheelchairs, feeding cups, chairs with fans. And so here's some pictures of, there's myrrh on the left, and there's a tourniquet that was used during the War for Independence on the right. So again, these soldiers had it pretty rough. However, we didn't know a lot better. This was our first time we've battled as a country against a major fighting force, and in a campaign that extended more than a few years. So what we did know was pretty sad. However, as we progressed on, we got better and better. Better knowledge, better techniques, better procedures. And those would be carried through to future campaigns in our country. But if it wasn't for people like von Steuben and Gates and Nathaniel Green and a couple others in Washington, along with his wife and Abigail Adams, it's hard to tell where we would be if we would have won the war, or if more soldiers would have died from disease than really should have. But so there you go. That's the camp life and medical conditions during the American Revolution in a nutshell. Again, if you want more and more in depth about this topic, please leave a comment, or if there's anything else you want to know about, again, leave a comment on the page. And thanks for tuning in, and we'll see you next time. Remember, tell your friends about us.